again. I'm Francisco Rivera. Today we have Dr. Bittar. He's a veterinarian and he's going to talk about pink eye. Welcome, Dr. Bittar. How are you doing today?
Hello, good morning, Francisco and Jonael. I'm very good. Thanks for having me here. And today we're going to talk about pink eye. It's keratoconjunctivitis bovine. That's a very important disease, especially in this tropical weather here in Florida, in summertime coming.
What is that? What type of disease?
So pink eye, it's a infection of the eye that's caused by a bacteria called Moraxella bovis or Moraxella bovaculi. And there are people even investigating the possibility of the Mycoplasma bovis to infect that eye.
So if the farmer have the pink eye in their animals, what are the signs and symptoms that they are going to see in their beef and dairy cattle?
So usually, if you take a look on the animals very frequently, you're going to caught this disease early. So you can see the animals are kind of tearing. You're going to see tears coming on their eyes. Looks like the animals are crying, but that's not. That's the excess of tears being produced. And you can see the skin and the hair below the eyes being wet, and then some flies around the eye. The animal gets kind of moving, it seems distressed. And then when the lesions are made, the infection is in the further stage, you can see some pink coloration on their eye, especially in the conjunctiva, where there was a kind of insult, a damage in the bacteria infected, and there's inflammation. That's why they call pink eye, because there is a pinkish, reddish coloration on the eye when the infection is occurring.
How many animals are infected in Florida in a year? Do you have an idea?
Okay, Francisco, I don't know the exact number of animals being affected in Florida, but it's high because in Florida, especially in summertime, we have a high temperature, high humidity, in which propitiate the proliferation of mosquitoes and flies, and the grass and some weeds can grow fast, and those are risk factors to damage the eye and open the doors for this bacterial infection. So it's high.
So that means that it's a common disease in Florida.
It is a very common disease in Florida, and not only in the beef cattle, dairy cattle as well. So when you talk about pink eye, it's not a new disease. So it's a disease that is here for a long time and doesn't gonna go away very easy. So it's better to work hard in preventing and reducing the incidence, reducing the risk and the number of animals getting affected.
Okay, and how we can do that? How we can prevent the contagious of this disease?
Okay, Francisco, this disease, the pink eye, you have to try to prevent it in different ways. So you have to try to reduce the flies and mosquitoes population and avoid or minimize the possibility of the animal gets their eye hurt, insulted, damaged. What I mean for that is if you have the grass or the vegetation, the pasture, the brush is high, whenever those animals with a lot of stem, whenever the animal is going to graze, there can be a high chance of have a damage on the animal's eye, in which is going to open the doors for the bacteria to come and to colonize and infect that eye. So keeping the grass short, with not much weeds on the pastures is one important way to prevent. The other important way to prevent is to reduce the population of mosquitoes and flies around. So you can use insecticide in a different ways. And there are some ear tags with insecticide. You can spray, you can apply pour on. And whenever you do this to aim the fly control, you have to always keep in mind to rotate those kind of products to reduce resistance of those flies. One example is if the rancher put a fly tag or a tag with an insecticide on it, make sure read the label, the manufacturer label, and see for how long that tag must be in the animal. Don't leave the tag forever because you're going to have low doses of the insecticide being released, in which can stimulate the resistance to insecticides from the flies easier. So it's very important to work with the veterinarian to have a strategy to control what insecticide to use, when to use it, and then go from there. There's one more factor to add to the prevention package. That's the vaccination of those animals. So there is a vaccine available in the market. However, it might not be 100% efficacious. Why? Because the type of bacteria that is in this vaccine, sometimes cannot match what is the bacteria type in your area.
Mm-hmm.
So, but it's one way to use it to prevent. What you can do to bypass that at a certain level is the production of autogenous vaccine. What is this? So you veterinarian goes on your area or on your property, collect the material from the eye from one sick animal with pink eye, and send out that sample to the laboratory in which is going to isolate the bacteria, Moraxella bovis or bovaculi, and going to produce a vaccine from that pathogen, from that bacteria. So it's going to be specific for that area. Those have more chances to get a better immunity. And then you need to vaccinate before the animals get sick, whenever the risk factor arises. So whenever before summer got here, hard on us, the flies population got hard, so we need to try to prevent in different ways, not only rely on one
Mm-hmm. So
strategy.
right now, with the situation that most of our farmers and ranchers are having with the COVID-19, and the the belief that some of them are not like selling their product, that means that they are more susceptible for
Yes,
getting this
that's an
disease.
important point now that you mentioned. So if the ranchers are not selling their calves, most likely they are going to retain ownership, going to keep those calves in their property. So we're going to have more animals, a higher stock density, and then with the temperatures getting higher now, high humidity. So it may be the case for the faster multiplication of the flies. And then if you have more cattle together, concentration of cattle, it might be easy to those animals to get injury and to the bacteria be transmitted from one animal to another animal. Very important to think now and act now, especially work with their veterinarians to prevent any outbreak, because when they come, it get costly. The animals lost weight, and there's a lot of expenses being used to control and to treat this disease.
And I hear that you said before, out of the air, that they reduce around 40% of their consumption. So that means that the animal are not going to eat, and are not going to produce weight, right? Or milk, depending of the animal that you are using.
Yeah, in this, so Francisco, it's not 40% of their intake. It's the importance of this disease. is that it affected performance. So there are some estimations in which the calves lost 20 to 40 pounds of weight. So instead, the animals concentrated, focus on eating, have a good dry matter intake, and gaining weight or producing milk to raise a calf or whatever. So this animal is going to be stressed, going to be painful with the disease. Therefore, they have a reduced dry matter intake and reduced performance compared to their herd mates.
Nice.
So the other big cost of this disease is the treatment. And then
That's what I was thinking right now. What is the treatment for this animal in case that the prevention didn't work? What is the next step with the treatment?
yes, if the animal end up getting sick, and some will do get pink eye, the part of the treatment is use of antibiotic. It can be used locally in the eye. Maybe it can be injected in the conjunctiva or systemically. And usually they are long-action antibiotics. So you have to work with the veterinarian to get those prescriptions and to use. And then they have a withdrawal. So you have to respect the limit, the time limit before selling that animal. The veterinarian can also prescribe anti-inflammatory or painkillers to help to reduce that inflammation and that discomfort of the animal. And also it's known that the affected animals with the pink eye can have higher sensitivity from the light. Therefore, we can advise to put an eye patch that cover that eye to reduce the irritability of the light in the animal, so the animal doesn't get too much stressed until it gets healed and cured. It's not an easy treatment. It's recommended to isolate the animal, to have in a patch or in a pen closer to the corrals, because some animals you need to treat daily for a few days in the row, so you have to handle that animal more often to make sure that the animal has a high chance of cure. And some animals, unfortunately, they end up in requiring a surgery to remove the eye, in which is going to add more cost for the producers, because the veterinarian needs to come and make a procedure, surgical procedure to remove that eye, and has a time to that animal to heal. So there's always a risk. So it's better to try and work hard to preventing than to treat. And then when the animals do get sick, work together with the veterinarians to make sure you are using the best tools available to treat and have higher chance of success. All right, so in summary, from how to deal with the pink eye, the keratoconjunctivitis in cattle, it's important to prevent, so to keep your grass mowed with less chance to have the animals have an injury or injuries on their eye, to have a good and effective fly and mosquitoes control. I know in Florida it's it can be crazy, but try to do your best to reduce the population of mosquitoes as you can.
Thank you, Dr. Bittar, for your time. We really appreciate that you are with us talking with this important disease that we need to prevent. Remember that if you have any question, you can contact your veterinarian.
Thank you, Francisco, and thank you, Jonael, and I hope you guys learn a little bit more about those important diseases that affect Florida. And then if you have any question and further help, please don't hesitate to contact us. Thanks.